For more exciting offers, download the Sushruta app from Play Store or App Store today.
Hi moms, today we are back on Child and You for a special session with a pediatric ophthalmologist, Dr. Deepak Garg, a very close friend and a colleague of mine with tremendous amount of experience in kids' eyes. I'm Dr. Nihar Parekh, and today we're going to embark on a special journey that deals with your kid's eyes. When to get his first eye checkup done? What are the common problems? How do I know my kid has numbers? We're going to tackle these issues one by one so you're a smarter and a happier mom. Today, I want all parents to pay real close attention to what we're going to discuss. With my colleague and a senior pediatric ophthalmologist, Dr. Deepak Garg, we are going to hit on this concept and term called lazy eye. A lot of parents have heard about it about their children. Someone has a lazy eye and this, but nobody knows that A, it doesn't present with any symptoms. It is very commonly missed. And B, if missed, the child can actually eventually land up losing vision. So let's take it very seriously. And Dr. Deepak is going to help us through this journey of the lazy eye.
Dr. Nihar, this is the most important question that exists in pediatric ophthalmology of lazy eye and amblyopia, or amblyopia, as is medically known. I will start by explaining a situation. Let's consider there is a newborn. Everything is normal, eyes are normal, vision is normal, and I patch one eye of that child. And let's imagine that we remove that patch at 8 years of age. When I remove that patch, the eye which had the patch for 8 years will have no vision. Even though the eye is completely normal. The eye has no vision because the patch prevented development of normal vision in the first 8 years of life. Similarly, if a child has a very different eye number in both eyes, and one eye has an eye number and the other eye has a low number, and the child has not worn glasses, the eye with a higher number is almost like wearing a patch, because the child did not wear glasses, so the child never saw clearly, and therefore the development of vision that should have happened in the first 8 years of life did not happen. Let's consider another situation. A child has a squint. A squint is one when the eyes are not aligned. One eye looks straight and one eye is deviated. The deviated eye is not really looking at things. It's the straight eye that is looking at things. If this condition is allowed to remain for the first 8 years of life, then the deviated eye has not undergone normal visual development, and thus the child will have poor vision in that eye. Therefore, if the eye is normal on examination, but if the vision is poor, that is what we call as lazy eye or amblyopia. Whenever there is a lazy eye, usually one eye has normal vision, and because of that, the child will not complain to the parents that he cannot see. The teachers at school may not pick up a problem either, because the child is performing everything that he is supposed to do quite well. The routine eye examination that we encourage parents to do for their children plays a very important role in diagnosing or detecting this lazy eye problem. Once a lazy eye is detected, the treatment for lazy eye is to force the weaker eye to work. So if one eye is weak, we want to force that eye to start seeing things. And we do that by patching the good eye. So we actually take a patch and we cover one eye so that the weaker eye is forced to see things. The treatment of patching is very easy for me to say in the clinic. It's not so easy for the parents to do at home, because commonsensically you are closing the only seeing eye of your child, and the child is not going to be happy. But it is very important to do this if detected, because Visual development happens only for the first 8-9 years of age, after which, even if you patch the eye, the vision development may not really happen. The neuroplasticity, the ability of the brain to change in the first 8 years of life is lost after 8 years. And thus, a routine eye examination to detect if your child has amblyopia is extremely important. In fact, when we do our school programs, we find around 20% of children need further eye examinations in clinics, and out of those 20%, about 80% need glasses. And out of those children, out of that 20%, we will always find about 10% having amblyopia. So amblyopia can be treated if detected in time. It is extremely important to detect and treat amblyopia so that we do not lose vision unnecessarily for that child.
Tune into our channel Child and You for tips and guidance to raise a healthy child.
Live now, live healthy, only with Sushruta. For any queries, you can write into us on or WhatsApp us on